Welcome to Roger That, a podcast presented by HVAF of Indiana. I'm your host, Lauren Carpenter, and join me as we discuss how HVAF is ending veteran homelessness and how you can join us in our mission. We'll be having conversations with community partners, staff members, and even some of the veterans we serve. We hope sharing more of our story with supporters like you can shine a light and give a voice to this vulnerable population, because no hero should ever be homeless. Here are some upcoming events happening at HVAF that we want you to know about. Stand Down, a resource fair for veterans, is September 7th from 12 to 3 p.m. at the Indiana National Guard Armory. At Stand Down, free resources are available to veterans, including food, clothing, and hygiene items, employment services, financial counseling, VA benefits assistance, and more. Stand Down is on September 7th from 12 to 3 p.m. at the Indiana National Guard Armory, 3912 West Minnesota Street in Indianapolis. For more information, please visit our website at hvafofindiana.org/events. Mark your calendars for the 10th annual Operation Alpha, happening Friday, November 10th at the Biltwell Event Center in Indianapolis. Local distillery Hotel Tango started Operation Alpha in 2014 as a way to raise funds for HVAF's operations, programs, and services. And Operation Alpha is just a night of fun and learning more about HVAF, and there are games such as a whiskey pull, a wine toss, there's a grog bowl ceremony. If you don't know what that is, look it up. It's pretty awesome. Also, a short little program to let you know more about HVAF, what we're doing, and for you to be able to support us. Last year, sponsors and attendees raised more than $125,000 for us, and we hope to raise even more this year. So come party with us at the biggest and bestest Veterans Day event in the state. Tickets are available soon, and if you're interested in sponsoring the event, please reach out to HVAF's VP for Advancement, Ashley Walls-Pierce, at awalls@hvaf.org. I'll add her email address and more event details in our show notes. All right, and today's episode of Roger That, I am going to be sharing with you all more about CHIP, which stands for Coalition of Homelessness Intervention and Prevention. CHIP, which is located in Indianapolis, mobilizes, advocates, and empowers community collaboration toward ending homelessness and fosters an effective system of homelessness prevention and intervention in the greater Indianapolis area. One effort CHIP leads is the point-in-time count, also known as the PIT count. The PIT count is an annual survey of homeless people in the United States conducted by local agencies called continuums of care, like CHIP, on behalf of the United States Department of Housing and Urban Development. This count also includes counting how many of the homeless are veterans, which is where HVAF comes in. So today we're going to be talking all things CHIP and the PIT count with two special guests. Our first guest is Danielle Bagg Wireman. Danielle is the Director of System Strategy for CHIP, and in this role, she supports the data analytics and operations team responsible for day-to-day operation of the Homeless Management Information System and Coordinated Entry System. Danielle plays a vital role in connecting data to continuum of care vision and strategy, and is endlessly entertained by creating dashboards to dive deeper into data. Her current work is focused on centralizing and standardizing core components of the Indianapolis rehousing system to improve efficiency and effectiveness. In my conversation with Danielle, we're going to be talking more about CHIP and her role there, and she's also going to give us an overview of the 2023 PIT count results, which just came out a few weeks ago. And my second guest today on Roger That is HVAF CEO Emmy Hildebrand. If you've listened to episode 1 of Roger That, then you know all about Emmy and the amazing work she has done over the last 11 years for HVAF and veterans in the community. She started at HVAF in 2012 as the organization's first public policy coordinator and has led the organization for 2 years. In my conversation with Emmy, we talk specifically on the data found on homeless veterans and how that affects HVAF. All right, let's get into it. Here is my conversation with Danielle and Emmy. Today on Roger That, I am welcomed by Danielle from CHIP. Danielle, how are you today?
I'm good. How are you?
Good. Thanks for joining us on Roger That.
Yeah, thanks for having me.
Of course, yeah. Excited to talk all things CHIP and PIT count. So I know you've been with CHIP for quite a while now, and now you're the Director of System Strategy. So if you just kind of want to go through like your role there and what you do and kind of what led you to where you are today there.
CHIP is the Coalition for Homelessness Intervention and Prevention, and we have several different roles within the community. I would say primarily we're an intermediary, so we are the backbone support to the Indianapolis continuum of care, providing a lot of logistical support, strategy support for everyone that's working to end homelessness in Indianapolis. We also collect and manage and analyze a lot of data through the Homeless Management Information System, which is the database we use to track homelessness in Indianapolis. We also run the Coordinated Entry System, which is the process through which we house folks and match them to resources. We work to secure funding on behalf of all of the providers in Indianapolis. So we also advocate for policy change on the local, national, and state level around housing and homelessness.
So yeah, what is, I guess, your role specifically at CHIP?
Yeah, so my role is very kind of external facing and continuum of care facing. My role it's a lot of things. It provides a lot of support to the data analytics and operations team, so the database and all of the data that we have across the city. But I also work really kind of to see the big picture around where there are gaps in our system, what's working well, what's not, where do we need to bring in additional funding to fill those gaps. That's kind of my role in a nutshell.
Yeah, and I know your background is in social work. How would you say that experience has helped you in this role now?
Yeah, I think foremost, I think it's always remembering that the numbers, it's people. The numbers are people. And really recognizing that at the end of the day, I think it's those social work values and ethics around dignity and worth of the person that really drive what I do, and recognizing that even though we aren't providing direct service with households experiencing homelessness, all the data and all the work that we do, it really represents people.
Mm-hmm. Yeah, that's really true. So why would you say then it's important to, have such a strategy when you track this data and, and keeping track of it and sharing it and all of that?
Yeah, I think first that homelessness is very complex. I think there's a lot of nuance to it. Federal funding is very complicated and very competitive. So I think we have to be strategic with our data and how we share success so that we can continue to receive federal funding. I think resources are also very limited. So I think it's really important that we are good stewards of the resources that we have and use them most effectively. And again, kind of seeing that big picture of what's happening in our system, what's working well, what's not.
When people are, who listen to us or follow us on social media, when they see something that we share from CHIP, it's usually the PIT count, which is the point in time count. So if you'd be able to just share kind of what the PIT count is and what would you like for people to know about it?
Yeah, so the PIT count, or point in time count, is officially what it's called. It's an annual single night census of everyone that's experiencing homelessness in a specific region, so a continuum of care. So for us, that's Indianapolis or Marion County. This happens across the country, in continuums of care across the country every year in one of the last 10 days of January. It is mandated by the United States Department of Housing and Urban Development, or HUD. And that data is really used to inform Congress. So it is very important, I think, that we all do it. There's really specific methodology and reporting guidelines that we follow. But so that's kind of the point in time count. So it includes counting folks that are both unsheltered, so maybe living outside in a vehicle in a place not meant for habitation, as well as folks that are in shelter, emergency shelter, transitional housing. And then alongside that is also the housing inventory count, which essentially is looking at all of the beds and units that we have available to serve households experiencing homelessness or formerly homeless, and how many people are in those beds on that night.
How do you guys, I guess I know you can't get everyone, but how do you make sure you can count as many people as possible?
Yeah, so it is a community effort. It is CHIP is kind of the designated entity to conduct the PIT count, but it is definitely a community effort. So working with street outreach professionals, working with service providers across the city, working with community volunteers. In the last several years, we've been doing the night of the count, and then we also do a continual count 4 days after that. So being able to go to libraries, to food pantries, and also collect data and survey folks that maybe we missed on the night of the count, so that we have as much coverage as we can across the city.
Yeah, actually in 2019, I volunteered to be part of it, and it was one of the coldest nights, I think, like record. It was
at the polar vortex.
Yes.
Oh yes, very cold.
Oh my gosh, yeah, which was, kind of was the point then of this, that it's supposed to be the coldest night. And we went in front of the Indiana War Memorial. They hand out food there on Wednesday nights. So so that kind of worked out, to count. And, it was, I was glad to do it. But of course, it was eye-opening, to see that there truly are people, especially how cold that night was, and to think that there were people out there.
It was very cold.
Yeah. Yeah. So I'm glad, we got to help in some way, to get that data to be able to share, so we can get more funding and support and all of that. So so this year's results just came out. And if you could just share a little bit of a breakdown of that, maybe some key takeaways that you'd want our listeners to go away with.
Yeah, so it kind of was a mixed bag. So some good news and some bad news. Good news is the count was down. It was down an 8% decrease from 2022. So this year's total count was 1,619 individuals that we counted experiencing homelessness on the night of January 23rd, 2023. It's slightly higher than pre-pandemic numbers, but we're coming back to pre-pandemic numbers. So that's good news. We did see a decrease in individuals and families that were in emergency shelter or shelter locations. On the flip side of that, we saw a really large increase in our unsheltered count, the highest that we've ever counted before. So that was something that was a big takeaway. The other thing that we're really looking at are disparities within the system and who is experiencing homelessness versus the population. So specifically Black households, we're seeing 52% of those that we counted identified as Black, compared to about 29% in the census data. And then when we look at those in shelter and those in families, that disparity goes even higher. So I think that's a big takeaway, is looking at who's experiencing homelessness and the disproportionalities that we see.
Yeah. And, now seeing these results, I guess, what is your reaction? What do you think next steps are?
The Continuum of Care, the governing body just released a really exciting goal to reduce Black homelessness by 35% by the 2025 point in time count. So I think that continuing to see this trend year over year really gives us focus on where to go, what strategies to employ. Point in time count data it's just one night, so it doesn't give us the big picture. It's great because you can compare it with other communities. You can kind of see our trends year over year, but it is limited in that it's just a one night count, and it doesn't give you the big picture of who's experiencing homelessness throughout the entire year.
Now seeing these results, you said that you use this to advocate for legislation into Congress. So this year's results specifically, what are you going to share then with Congress?
So that is all of the data that's collected from each individual continuum of care then goes to HUD, and then they will produce a giant annual homelessness assessment report that's provided to Congress. So it looks at trends across the nation. But I think we have to compare that to like rising rent, rising housing costs, the lack of affordable housing. And so I think looking at the point in time count data compared to those other data sources can really tell a fuller picture.
Yeah. What are some other ways that you guys throughout the year collect this data?
Yeah. So through the Homeless Management Information System, we are looking at data on a regular basis. We have a core set of dashboards that we update to kind of visually represent the data that are updated monthly on it's indycoc.org is the website. So looking at not only who is experiencing homelessness on the night of the point in time count, but looking at that data across the year. So we can look at who's experiencing homelessness over that whole year. Does it look like the same folks that are experiencing homelessness on the night of the point in time count? Looking at performance, looking at our housing placement rate, looking at returns to homelessness, and looking at equity at every possible interjection.
Why do you think it's important for people who in this community to care about these results?
Yeah, I think when you really look at the point in time count, you realize that homelessness isn't always just what you see. There's a lot of variety, a lot of different people that are experiencing homelessness. It looks very different for very different people. So I think it's important to know that, the visible homelessness that you might see on the street isn't the whole picture. There are a lot of folks, a lot of families, veterans, youth and young adults that are in shelter and transitional housing. And so I think that this data set can really help kind of understand what it looks like on any given day, but across the whole system.
Yeah, is there anything else that you want to share with our listeners, that about CHIP, about the PIT count, anything that you'd like for them to know?
Yeah, I mean, I think, like I said, like this is just a one time of a year thing. I will say, like, we're housing more and more people each year. And so point in time count doesn't really show that. It's just a census count. So being able to recognize how much progress is being made and that there is a lot of work that's being done, and some really great success. We know what works. And at the end of the day, this is a housing issue. It's really not a homelessness issue. I would really encourage folks to advocate for policy change legislation that protects people renting, protects tenants, protects homeowners, because at the end of the day, like I said, it is about housing.
Well, thank you so much, Danielle, for sharing more about CHIP and about the point in time count. And just thank you for taking time to share that with us today.
Yeah, thanks for having me.
All right. Well, we just spoke with Danielle from CHIP about CHIP and the PIT count results. And now we are here with HVAF CEO Emmy Hildebrand. And we're going to just dive more into the PIT count and how it affects veterans that we serve and veterans in Indianapolis more specifically. So
sounds good.
All right, let's get into it. So if you just want to share first what the results were for veterans specifically.
Sure. So the 2023 PIT count reflected that veteran homelessness increased by 9% here in Indianapolis. Raw numbers means it's up to 182 over 167 last year. So an increase of 25 veterans. And that unsheltered homelessness among veterans more than doubled. And it's up to 27 veterans now who are living unsheltered on our streets.
Yeah. And, I know last year we were really excited because it decreased by 35%. So now this year we see there's an increase of 9%. So why do you think there was such a decrease last year? And then why now we're seeing an increase this year?
I think they're both for the same reason. Last year, we were still experiencing a huge increase in emergency funding through the different COVID legislation. So first the CARES Act, and then second, the American Rescue Plan included a lot of money for housing the most vulnerable in our community. It increased rapid rehousing in both our Supportive Services for Veteran Families grant and Emergency Solutions grant. So we were able to serve many more veteran families with longer term of rental assistance. And that all started to go away last year. And the PIT count reflects that too. There was a 33% decrease in the number of rapid rehousing beds available in our community this year as compared to last year. And I think that directly translates to more homelessness among those in our community.
Yeah. Can you go a little bit more into the grants that we had during COVID and now that we don't have those anymore?
Sure. So I think that's kind of the silver lining of COVID is that as hard as it was for most people, the government and major funders recognize that it's much harder on those experiencing homelessness. So the generosity first started with United Way and the Lilly Endowment. They really invested heavily in our community to help nonprofits like HVAF who are serving those facing homelessness. So we had emergency grants from United Way that we were able to use that honestly helped us keep running the operation in those sort of first early and very scary days of COVID. But also the VA and HUD expanded all of the homeless assistance programs. So we were able to make sure that veterans weren't forced to live in congregate shelter situations. We implemented emergency hotel stays to prevent, that kind of shared space where COVID could easily be transmissible. So we were able to, quickly move veterans from shelter to hotel to housing and then help them with longer terms of rental assistance than we usually can.
Mm-hmm. Yeah. So what are then this year with, losing that funding and I guess maybe why are we losing it and how have we seen that change this year?
So on May 11th, the public health emergency officially ended for COVID. So we're out of the pandemic, even though COVID is still a thing. And with it, those expanded authorizations for funding. So our rate for repayment went down in our transitional housing programs, and also the sort of special funding for rapid rehousing programs is starting to get scaled back as well. So what we're trying to do is remind ourselves how we operate in a non-pandemic environment. And unfortunately, that means, during COVID, we could provide rental assistance for many months for veterans who just needed a little extra help to maintain their housing. We're not able to do that. We've got to get back to shorter terms of rental assistance, less funding per veteran, and making sure that what we're providing hopefully is enough to be sustainable for their housing, but it can't be unlimited assistance like it was during COVID.
Yeah, but it's hard because we're serving more veterans than we were before. So it would be helpful to have, more funding for that.
It would. And we're advocating for that and making sure that, not just the federal government, but also our donors and supporters see that we're really managing those funds very well. More than 80 cents of every dollar that we raise goes directly to veterans to meet their needs and provide for their housing, utility assistance, basic needs assistance. But this is hard work and it does require funds to keep it going. And I think, we've all seen the news stories about inflation and higher costs of living. That's the same for the veterans that we serve. They just have less resources to be able to withstand that.
Yeah. So let's go back to the PIC count then. When you saw these results, saw that there's an increase rather than a decrease from like it was last year, what was your initial reaction to that?
I think anyone's initial reaction would be like, well, what does that mean? Does that mean your programs don't work? Are you not as effective as you were a year ago? And as much as I would like to think that the world revolves around HVAF and the work that we're doing, it doesn't. And there are so many more factors that influence homelessness. We're just a piece, right? We're the response to homelessness. We can't control, the costs of apartments and homes here in Marion County, which have gone up dramatically, especially here in Center Township. We can't control utility costs, which have gone up by 20% in the last 4 or 5 years. We can't control inflation and the cost of food, which we know has gone up. And all of those impact veterans who are living in poverty, who may not yet be homelessness, but with just, a couple of emergencies or an increase that they can't afford, might be facing homelessness.
What do you think that HVF can do to help these numbers to decrease year over year?
So we're trying to be really innovative with our programming, and knowing that there are several factors that contribute to homelessness, we're trying to provide support to address all of them. So we've got an employment program to help with veterans who aren't earning enough funds to be self-sufficient. We've got an in-house therapy program to address the mental health and substance use issues that sometimes contribute to homelessness. So we're trying to build out programs that can help all of these things to be able to impact what we can, recognizing again that there are so many things that are out of our control, but we do want to be here to be a resource for veterans in our community and to help those who need it the most.
Yeah, that's what I think. Something that we do that I find interesting is that, it's not just us giving someone a home. There's a lot of other barriers, because if we just gave them a home, then they'd probably go right back into homelessness.
Right. I mean, if you don't have a job, but you have an apartment, and we pay this month's rent, who's going to pay next month?
Right.
So we want to make sure that veterans are really equipped with the skills that they need to be self-sufficient. And I think that that's how we kind of work on the homelessness prevention. But I also see this very much as triage. So, especially living unsheltered or literal homelessness is kind of the urgent and emergency situation that has to be addressed first. And once we get that kind of under control, then you can go upstream and work on some of the prevention stuff. So we're still in that sort of urgent situation. We have so many veterans that are homeless and living on our streets. So we need to focus all of our attention there while also working on some of the prevention aspects as well.
How can our listeners join in us helping veterans in the community, to be able to overcome these barriers and again for the PIC count to be able to, we can say that the numbers have decreased each year?
So, I mean, there are some things I think that are within our community's control. Obviously, supporting the work that we're doing here goes a long way. Come alongside us, join in our mission, and people can do that with their time and their talent and their treasure. All of those things make a big difference here at HVAF. But I think there are also other practical things that people can do. If you're a landlord, think about renting to a veteran who maybe doesn't meet all your criteria, but maybe you can overlook a bankruptcy or a criminal conviction, knowing that, this is a person who served our country, and this could be the one thing that you could do that could change their life. Same with an employer. If you're willing to overlook a criminal conviction, it may just change someone's life and give them an opportunity that otherwise they may not have.
Yeah. Is there anything else, from the results this year, with the pig count, that, or, with the current or the recent legislation changes that you want our listeners to know?
I think it would always be helpful to, contact members of Congress and also our state and local officials too, and let them know that this is important work that's happening. And in communities around the country that have been successful in ending veteran homelessness, it's been a collaborative effort among nonprofits, but also local, state, and federal government all working together to make sure that the resources are available and the will to get the work is done is there too. So, keep this top of mind for everybody. 182 veterans living on our streets is unacceptable. And we owe these men and women so much more than that. So for me, this is just kind of a reminder of how important a task we have ahead of us, how we need to make sure that we're using every single dollar we have to change someone's life. And we are doing that.
All right, that wraps up this episode of Roger That. Thank you so much for listening. If you haven't already, please be sure to subscribe to Roger That on wherever you get your podcasts. And be sure to follow us on social media at HVAF of Indiana. And for even more stories on HVAF and the veterans that we serve, check out our blog on our website at hvaf.org. Thank you, and until no hero is homeless, we'll see you next time on Roger That, a podcast presented by HVAF of Indiana.